So the pilot said they should wake him up. Wanted to be sure that the guy was conscious. You are going to Nigeria, this is your international, this is your name. Ask him all the questions. The guy was coming here to Nigeria for miracles, but he was sick. I was in South Africa. I went to see a staff of ours, a branch manager in Maiduguri, who was shot. He had a gunshot wound on his shoulder area. I went to see him because we sent him to South Africa for treatment. So I look at it, our guys went to South Africa for medical tourism. South Africans were coming to Nigeria for religious tourism or miracle. My wife read economics. She said, so when I explained it, she said, that's balance of trade. I almost fainted. But why am I saying this? Is that, I attended my first degree, second degree, I attended University of Ibadan. And I can tell you for free, in the 60s and 70s, UCH was a global standard teaching hospital. I attended a program in Harvard with some, family members of the Saudi royal family. And the guy told me that his first time in Nigeria was in the 60s. He accompanied one of his uncles for treatment in UCH. This is from Saudi Arabia. So you can see the passion and the commitment. We need to find a way together. And that is why for us in Stanbic IBTC, we believe we can play in the totality of the value chain. I had a discussion last year with Professor Emeritus, I won't mention his name, in pharmacy. And we were discussing, when I started to tell him the value chain within which we are playing when it comes to the healthcare sector, he just had to accept that, look, because it's not noise, it's substance. And by the time I discussed with him at length, both of us we spent 1 hour on the call, going through some documents that had to do with API. API is not within the tech industry. In pharmaceutical industry, it's called the active pharmaceutical ingredient. And that is the backward integration. So we were discussing that, and the guy was looking, and the prof was saying, I said, yeah, because we have to be able to play within the totality of the value chain of the healthcare sector. That is why you will see us, supporting the pharmaceutical firms. You will see us supporting those who are doing backward integration. You will see us supporting, whether you call it, the manpower development, teaching hospitals. I won't mention name again. Another one in Abuja. Almost standing on what now? 10,000 square meters. About 3 floors. We supported them. We had to support them. Because last year, May, I attended a graduation program in New York. A university, in the West Indies, graduated over 1,200 medical doctors and released them into the US for residency. One university. So when I met and I discussed with the vice chancellor of one of the universities here, we compared the number of professors in the 2 universities. He said, look, we need to raise productivity. That university that delivered over 1,200 medical doctors in a year, they don't have 200 professors. So why can't we, and it goes to show, the headroom for growth. So I'm trying to explain to us that for us, the commitment is 100%. We are passionate about this space. And it was as if, because I was having a side discussion, it was as if we've seen some of the barriers in the past. We envision that the banking industry, whether we like it or not, because of regulation, they call them Basel II guidelines. The risk community guys, they know Basel II, Basel III guidelines. There is a limit to what a bank can do. A bank, in terms of giving you long-term, facility. What do we mean? A facility for 10 years, 15 years, 20 years. It's not as if they don't want to do it. If they do it from day one, they will take a provision that will make it suboptimal because of the duration. So what did we do in Stanbic IBTC? About 3-4 years ago, we set up our own infrastructure fund. It is outside of the bank. Before I came to this podium, we were having that discussion. That infrastructure fund is not shackled by the limitations of Basel II, Basel III that a bank will be subjected to. That infrastructure fund is under our Stanbic IBTC asset management. So what did we do with that fund? We went to the Securities and Exchange Commission. We put 100 billion naira program on the shelf. As we speak today, we are almost 75%, in terms of utilization. We have filed another application with SEC. Please, the money is not in our pocket, so please, when we mention money, it's not as if we are carrying them. Because we want to get home safely. Because we've done 75% utilization of that 100 billion, we filed another application with SEC for Infrastructure Fund 2. It's 350 billion. We put it on the program. We put it on the shelf. Anybody here can tap into that. Again, that is where you can get long-term funding. The bank can help with short-term, maximum 2 years, 3 years, working capital. But if you need to transform any of your facilities, structures, infrastructure, that you would need a facility of, let's say, 7 years, 10 years, that is the place we will point you to. And it shows our commitment. Now, my last point I will make is to let you know, I discussed with one of our customers and we had to interrogate. It's not impossible that they have representatives here, but I won't mention names. The OEMs for most of the equipment that we use in the hospitals. Global OEMs. You understand? So I went to the headquarters of one of them in US. I think it was during COVID or post-COVID. We are the first set of people they will see because we are still wearing masks. The whole building was empty, but they opened the floor for us. And when they told us what they would do, because we have got, an equipment arrangement where, with maybe 20 or 30%, we fund the equipment, we pay directly to the OEMs. You get the scanner, you get the ML, you get all those things. But one of them was giving us conditions that we felt was suboptimal. Those conditions were suboptimal to what they've given Stanbic Kenya, Stanbic in another country. So we had to tackle them. To say that you cannot give us a suboptimal condition because we are Nigerians. And this is the largest market. I can tell you for 6 months, we had to chase them. And we had to get them to back down. To give us conditions in Nigeria that those conditions are comparable to what they've given, Standard Bank, our colleagues, our sister companies in other countries. And that is to let us know that, look, there's one thing to put money down. There's another thing to go and check some of the things that are very, very important to make it easier for all of us. So please take it from us. I hope that you are going to have very robust engagement. As a group, Stanbic IBTC, we put the totality of our weight, behind this sector. Whether it's in the private sector, in the public sector, we are ready, willing. There are some of we call them primary healthcare centers that we've gone ahead to adopt. Right, and we are doing it deliberately and intentionally to let us see our commitment to this sector. So, welcome once again. I wish everybody here very successful, robust and very fulfilling and rewarding engagement. Thank you. God bless you.
Thank you very much, Dr. Demola Shogunle. Please let's give him another round of applause for that passionate delivery, because he did say that he was not going to read his speech, but you can tell with the passion with which he spoke, which was almost palpable, that he genuinely cares about the healthcare sector in Nigeria, because we understand that the healthcare sector is at the center of any nation's prosperity and well-being. Thank you so much, sir, and good morning once again. Thank you all for joining us. I see that the room is fuller. This means a lot to us because this is a very critical conversation that we are getting on. And just as he was speaking, he did say that this means a lot to Stanbic IBTC Bank, especially because the healthcare sector is, one of the sectors they prioritize. And we see by their investments in that sector across West Africa, across Nigeria. So thank you, Stanbic IBTC Bank, and thank you to everyone who has joined us today. I'd like to make a quick announcement that if you'd like to access the agenda, you can check your tables. There's a QR code there. You can scan it. As a progressive bank, we thought not to share sheets, so you can scan. Technology has advanced, and so we are giving you that opportunity to have access to the agenda if you'd like to see the program for the day. I'd like to especially recognize Dr. Pamela Ajayi, who is the President, Healthcare Federation of Nigeria. Please give her a warm round of applause. Thank you for joining us, and let's sustain that applause as she comes to address us for a few minutes this morning. Thank you for joining us this morning. Everyone, please sustain the applause. We're truly honored to have her in our midst this morning.
Good morning, ladies and gentlemen. Our CEO, distinguished keynote speaker Claire, and distinguished panelists, ladies and gentlemen. It gives me great pleasure to be here today at this first healthcare breakfast session sponsored and created by Stanbic IBTC. I don't want to spend too much time because our erudite CEO has actually said it all about what Stanbic IBTC is doing, but I do want to thank them specifically for partnering with us at our recent HFN annual conference and AGM last week. Thank you very much. Making healthcare investable, what an important topic. It is so critical at this time when we are actually in a crisis in healthcare. We are very fortunate with our president who has shone the light on healthcare and has actually prioritized healthcare in his agenda for the country. But we know that it is not just a simple matter of, someone shining the light. We have to actually fix the system and fix the system from within. Because if we don't make healthcare more investable, and what is very interesting is many people still think that healthcare should be a social service, not understanding how important it is for sustainability, that healthcare is profitability. I always tell them, I say profitability is not greed. Profitability is sustainability in healthcare. And it is so important that we focus on that. We have a crisis with people leaving the country. If the organizations in healthcare are not being paid adequately, they cannot pay people to actually run the service. And then the people leave. And without people, we have no service. I do strongly agree with the CEO that technology can go a long way towards helping us do what it is we need to do and develop our systems, in particular with extending our services into the rural areas and other places that need care. But all in all, we cannot do all of the above if we do not have infrastructure, if we do not have people, and if we do not have an investable and a vibrant healthcare system. So I just want to say, because I know we have very good speakers coming on to talk, thank you very much, all of us, for being here, for taking our time out to be here today. And I wish all of us very successful deliberations as we move healthcare forward. Thank you very much.
Thank you very much, Dr. Pamela, for joining us. Give her another round of applause, please. Thank you. Now, distinguished ladies and gentlemen, without further ado, I will be introducing our keynote speaker today. It gives me great pleasure to introduce a remarkable leader and a pioneer in the healthcare industry. She is the CEO of JNC International Limited. With a distinguished career spanning years of dedication to advancing healthcare solutions and improving medical services, she has established herself as a driving force in advancing healthcare solutions and improving access to quality medical care. Today, as we gather to explore new horizons and chart the course for the future of healthcare, we are privileged indeed to have in our midst Mrs. Claire Omasheye grace us with her presence today. Please give her a warm round of applause. She'll be sharing her valuable insights with us today. Let's sustain the applause. We're truly honored to have you here. Thank you.
Thank you very much for that very warm and fluffy introduction to the CEO of Stanbic IBTC, distinguished panelists, distinguished VIPs in the room, our guests online, ladies and gentlemen. Let me first start by saying a very big thank you to the bank for thinking it wise to invest in the healthcare space. If anybody didn't know that healthcare had a direct correlation with economics, I think after COVID, we all can see the direct correlation, and that we all have vested interest in the healthcare space to be able to make a difference. So when a bank now decides to be deliberate, to have a breakfast session like this, with all of us here to elucidate the importance of strategic partnerships, and most importantly, about investing in healthcare, we cannot but support you all the way and say a big thank you. So can we give the bank a round of applause, please? So I've been asked to speak for a short while on strategic partnerships, catalysts for transforming Nigeria's healthcare sector. I have a short outline here, which is on the slide, and I'll just move on straight away. Now, when we think about healthcare, there's a lot of challenges, as the president of the Healthcare Federation of Nigeria said. What I'd like to set the tone from the beginning is that although I don't like to spend time on challenges, if we don't know the challenges, then we will not be able to find the solutions. For every time there is a challenge, there are at least 2 or 3 opportunities. So I do hope that at the end of this session, before we go and leave this room, that we will be able to look at healthcare in a different light and see where those opportunities are. Whether you're in the tech space, in the healthcare space, you're in the finance space, there is something in it for everyone to be able to be a stakeholder in this ecosystem building. So having a look at Nigeria and where we are, if I look first at the African continent, Africa has 25% of the disease burden in the world, yet only has 1.3% of the global workforce. The topic at the moment, not only in healthcare but everywhere, is this Japa syndrome, where we're losing our best and brightest to some of the other countries in the world. This is no different in healthcare, and we need to be able to stem that tide. But to be able to do that, we need to work collaboratively, strategically, with government to create an enabling environment to change that narrative. We have poor access to quality healthcare. We have dilapidated infrastructure, moribund infrastructure all over the country. Over 10,000 primary healthcare centers, many of them you can't really attend and go to. We have had brain drain over the years, not a new one, but now, even more than anything else, a very big concern to us. We also have prevalence of communicable diseases, but a double-edged sword with non-communicable diseases. We have a rise in cardiovascular disease. A few weeks ago, we had a football match, and you know what happened when some people watched the match. We had, unfortunately, lost a few people, didn't understand that they had underlying cardiac issues, and some of us are walking and talking time bombs, and we need to do our checkups and go to the hospital more often. Then we have a rise in cancers, and you can probably do a direct correlation with lifestyle, with our sedentary lifestyle, with the kind of food we eat, and things like that. And of course, our life expectancy, unfortunately, in our country is quite low compared to every other country, with 54 years. And I think of a country just close by to us, Ghana, is at 64 years. So there's something that needs to be deliberately done to change this narrative for healthcare. On top of this, we have what we call the patient drain, medical tourism, outbound medical tourism, that is almost more than actually $1 billion on an annual basis that is leaving the shores, that if we can harness this by having the right kind of infrastructure, by keeping our doctors, nurses, pharmacists in country, by having world-class hospitals and having access to finance, both on the demand and the supply side, That means both for the patients to be able to afford it and for the hospitals to be able to provide the infrastructure. We could make a difference. This next slide looks at those 5 pillars when we talk about healthcare strengthening. What are the 5 pillars of healthcare strengthening? So on the right-hand side here, you have healthcare delivery systems. I've actually already given a summary all across board, that the delivery systems themselves are not where they should be. But what I really like to spend a little bit of time on is this issue of healthcare financing, because this is a bank, Stanbic IBTC day. And unfortunately, when we come to out-of-pocket expenses, it is as low as 0, doesn't exist. It is between 62% and in some cases as high as 90%. Now this sounds like, okay, every time I get sick, I have to spend out of my pocket. But the challenge is that we're not talking about out-of-pocket expenses. When we talk about cancers, when we talk about cardiovascular intervention, we're talking about catastrophic out-of-pocket, where people have to make very difficult decisions, where a mother has several children in the house, and she has to choose between which of her kids is she going to give the anti-malarial to. Is it her firstborn, who is a girl? Is it the lastborn, who is a boy? Is it the middle child? What kind of decisions do you need to do? Somebody has cancer and they're in their 60s. Do you spend the money, all the savings, break the bank, sell all the assets? So difficult decisions need to be made, and therefore, when we think about financing, even as a bank, we have to think of both demand and supply side financing. But to the complete left side of the slide, I'd like to focus on the topic of today, which is partnerships for health. We are not doing enough in terms of strategic partnerships and not leveraging on the opportunities. It is great that today we have this opportunity of having healthcare and finance meet head on. And that's what we need. We need the tech industry, entertainment industry, healthcare, to not think in silos, but to come together collaboratively and find solutions that can unlock the potentials. We have a lot of donor agencies that provide funding for various programs, but they're in silos. There's really no collaboration between the various programs. Now we bring it down to 2024 and today's budget. And the next slide shows you about today's budget. We have a very big amount of money, 1.3 trillion naira being spent on healthcare in 2024. It sounds like a lot of money, but compared to the total budget, it is only 4.4%. Now, even when we add all the additional funding that's coming from some of the donor partners, that still only comes to 1.5 trillion naira, which is still 5.46%. Many years ago, we had the Abuja Declaration, where countries in Africa agreed that to be able to give people access to universal health coverage, we need to have at least 15% of the total budget of a country spent on healthcare. So it shows we have a long way to go. However, I'm not a politician, but you must give and tap the back of government when they do the right thing. Next slide, please. This year, in 2024, we are blessed to have, under the leadership of the president, a focus on healthcare. When politicians start to walk the talk, we have to say thank you. Why? Because if you do not have political will, then we can't change the narrative. Access to finance for the masses can only come from government resources. It really can't come from private sector. But in this budget this year, we're seeing a huge focus on infrastructural development in the public sector. We have over 77 billion naira, which is going into revamping various hospitals in the 6 geopolitical zones, their diagnostic capabilities, MRI, CTs, and so on and so forth, laboratories, theaters. This is a great start in the right direction. And under the leadership of Dr. Pate, Professor Pate, Dr. Alausa, and the PS, we have a trio who are really determined to walk the talk. It is us in this room now that need to put a scorecard with them that make sure that that goes from walk to talk. And I'm sure that we can do this together. So what is the importance of strategic partnerships, and why do we need this to happen? I totally think that collaboration is the new innovation. And without collaboration, we will not be able to change the narrative. And it's important for transformation. We have on the slide here the things that just show you how this is important. If 75% of the medicines that we use in Nigeria are imported, if we had another 6 months of COVID, we would have had complete drug insecurity. There would have been no access to medicines because our pharmaceutical industry was not in a position to be able to provide it. We had no real API, active pharmaceutical ingredient production. So there's a lot that needs to be done across the entire value chain. So although we are focusing a lot on hospitals, we need to do backward integration into all the various consumables, pharmaceuticals that are required. We need to have resilience with drug security, medicine security, and that means homegrown solutions. We need to have policy that encourages, just like what the industry did, oil industry, where they had ring-fenced local oil companies. We need to have the same in the healthcare sector, where local producers are given preference, even if it is 20, 30% higher, then we need to buy Nigerian for Nigeria, buy Nigeria first. That is the kind of policy that we need to be able to have. So strategic partnerships are very essential for various reasons. And to be able to get this going, we must first be able to influence policy. So I'm really happy that Dr. Pamela Ajayi is here, because the truth is that everybody trying to talk to government alone is not as impactful of all of us coming together to unite with one voice. So in the healthcare industry, we have the Healthcare Federation of Nigeria, which directly interacts with government to influence policies. And I must say, over the last 10 years, there's been a lot of impact that the Healthcare Federation has done. So thank you very much, Madam President, for the wonderful work that you're doing. Of course, we also need to leverage on speed and efficiencies. When people come together, great ideas, each of us levers on the strength, be able to make things happen better. We need to risk pool. There is a lot of risk when you do business in our climb. But when we are working collaboratively, we are slightly and helping to de-risk transactions. Banks like this kind of words, de-risking transactions, making it less risky, and so on and so forth. We also unlock creativity and innovation, which is very essential to be able to change the narrative. We have to collectively solve problems. So one idea cannot be the same as three people, three companies, three different market segments coming together to solve problems together. And of course, we need to be able to be resilient and adapt to change. So these are some of the things that we want. And finally, with those partnerships, we can then scale up, and we need to be able to scale up. Disruption that we're talking about is innovative disruption, not just disrupting ourselves and not just doing things out of the box for no reason. We have to almost throw away the box and don't be limited by the box. We have to think differently, disruptively, and innovatively. So from all our standpoints, anybody in healthcare, yes, we have to start with optimizing your operations, but we need to leverage on technology and learn from other industries. If I look at the banking sector, when I was in university, I had to go to the bank, drop my check, they give me a tally, I wait 5 hours, go back and see if my money is ready. Still no guarantee. Now I can dare anybody, fastest fingers, can you transfer even ₦1 million in 30 seconds? And most of us here can. That is the role that technology has changed in transforming the sector. How do we take those learnings from entertainment, from real estate, Airbnb, hailing a taxi, to banking, to healthcare? How can we bring it down and provide, using technology, access to quality healthcare, to the rural, to the last mile? These are things that we need to do differently, and the answer really is going digital. So for us to be able to think strategically and to think about strategic partnerships, what are the things and what are the benefits that we can do to be able to make a difference? First thing I think is domestic resource mobilization, that we can together think of different ways, finance, healthcare, tech, coming together to mobilize resources, also look at ways in which we can either do, I don't want to call them sin taxes, but look at innovative ways of finding maybe luxury taxes and channeling it to providing finance on the demand side, whereas the banks can look at the supply side. But we have to fix two sides of the equation, because there's no need of collaborating, having big hospitals and pharmaceutical industries everywhere, and the average Nigerian cannot afford the treatment or afford the drugs. I was told a short while ago that a lot of people who are asthmatic on a particular drug before, it was less than 10,000 naira. And now for this same drug, it's in excess of 60 to 70,000 naira. Now we need to have our homegrown solutions, our own R&D, do some backward integration. We have, and our forefathers had a lot of medicines that could help with things like that. But in the meantime, prior to us doing the R&D, we need to have the security in our country. And therefore, there needs to be collaboration, perhaps Government needs to collaborate with private sector to build specific industries that tackle our major non-communicable disease challenges. And working alongside banks, working alongside institutions like Stanbic IBTC, we would be able to collectively change that narrative and do the resource mobilization. Public-private partnerships have not been new to Nigeria, but we need to go from the small PPPs that we have in healthcare to the PPIs as we see in the UK, in Turkey. I have done many trips to Turkey and I've seen the amount of infrastructure they have there. The entire system in Turkey was built on public-private partnerships. But the difference is that the government becomes an off-taker. And when you have an off-taker, it spurs investment because you're sure you have been giving guarantees. If I'm given a guarantee that I'm going to have 1,000 patients come through my door every month, I will make the investment. And I'm looking at investors in this room. The banks will also lend money because you have an off-taker. But in the absence of solving both demand and supply side things, it is very difficult. In PPPs too, we also need to have the right enabling environment and framework to protect the investors and the bankers. And when you have, for example, in certain hospitals, bad practices where people leave the hospital and they go outside the gate and, provide services to people outside the gate to earn a commission, we need to get rid of bad practices that are de-incentivizing healthcare investments. There are lots of new policies that have been worked on. We need to make them workable. We have an incentivizing healthcare investment policy. We have a dedicated public-private partnership policy, but it has not been implemented. So working collaboratively with the bank, with your bank, for example, would be one of those ways in which we can change that narrative because we need the right regulatory environment and legislation to be able to protect our investments. We need to be deliberate about capacity building, and strategic partnerships gives us opportunity. What is the use of having all these high-tech equipment, linear accelerators, MRIs, and CTs, and you do not have engineers, homegrown engineers in country to fix them? They were waiting for expats at the dollar rate of, I'm not sure what it is today, but I can dare say almost 1,900 because the last couple of days it's been going up exponentially by 50 to 100 naira. But can we afford expats to be coming in and be paying dollars? It's bad enough that we have to import the equipment, and on top of that, we now layer the service. So we need to have a curriculum in our medical schools, in our biomedical engineering schools that is relevant, and then part of our responsibilities of collaboration needs to be capacity building and advocacy for that change. We have partners internationally that we need to work with private sector. Most of the time, these partners, please put the partners up, they work only with government. But I'm sure, and I'm seeing a lot more now, that some of these partners are now interested in working directly, providing capacity building grants with the private sector. So the Bill and Melinda Gates Foundation, JAPIGO, USAID, Global Fund, PEPFAR, UKTI, a lot of them are already in the country now working and utilizing private sector. The value chain, the supply chain of the private sector. We need to leverage on this and lobby and advocate. This is where the banks can do some mezzanine financing, where you do blended financing. Take your commercial financing, add the patient capital, and give us patient financing for our patients. Yes, that's what we require. So with public-private partnerships, as I said, we need to get through this hoop, work collaboratively with federations like the Healthcare Federation, with PSHAN, with the NESG, and be able to advocate for a change in policy to create that enabling environment for public-private partnership. So to try and conclude on this, how do we take this forward from just talking about collaboration, from talking talking about the importance of working together to being very strategic and changing that narrative? First, I'd like to just emphasize this importance of going back to the basics, understanding our challenges. For every time there's a challenge, looking at where the opportunities are, streamlining the opportunities because we cannot be everything to everyone. Let's find the things that are low-hanging fruits that have the biggest impact together. Let's again advocate for the enabling environment that gets rid of multiple taxation, that gets rid of the bottlenecks at the ports, that stops customs from changing tariffs every other day and making it almost impossible for you to price, to stop the bottlenecks of bureaucracy with some of our regulatory agencies that make consumables and things coming into the country very difficult and very hard for our hospitals to be able to provide a service that is great. We also need to enforce the mandatory healthcare insurance, and government needs to put a dedicated budget that pays for people together. Now this collaboration, this ecosystem building is a collective responsibility. So to conclude here, if we don't collaborate, we stand, where we're at a point where the silence in the room says it all. We don't have a choice. We either collaborate, we either disrupt ourselves, or be disrupted. The choice is ours. So today, I'm sure that the speakers on the panel are going to do a lot of justice to show us that collaboration and strategic partnership is the only way out. It is something that's going to make a difference in healthcare and make healthcare a major contributor to GDP, just as it is in every other clime. In the US, healthcare contributes between 9 and 11% of the GDP in the country. So we need to be able to do that same thing. So we do have an arduous task ahead of us, but with our concerted efforts to make a difference, we will be able to do the right thing. Put the governance structures in place, get the right regulation, get an incentive, a basket of incentives, both physical and non-physical incentives in place, redesign the system for success, and finally, do innovative financing. Think out of the box. And I dare say that Albert Einstein said, in the middle of every difficulty lies the opportunity. In all the difficulties that we're going through, with all the challenges that we're going through, ladies and gentlemen, there are vast opportunities to invest in the healthcare space. I dare say that let's all know that this is a collective responsibility, and victory comes from when you find opportunities to problems. So please, find opportunities to problems, and let's take our country forward. Thank you very much.
Thank you very much, Mrs. Claire Omashe. Our keynote speaker has done justice to the conversation around strategic partnerships being a catalyst for transforming Nigeria's healthcare sector. Thank you. And I think one critical thing that stood out for me is the fact that collaboration is the new innovation, and I think that is so phenomenal and profound. So yes, we're talking about collaboration on a larger scale, but let's start from this room. Do you know the person sitting next to you? I mean, we have different stakeholders, so let's connect, let's collaborate informally before we look at that bigger picture. So we do have various stakeholders, people from, so ask them for their names, what they do, what sector, what part of the value chain they operate in, and how you can connect with them. So this is a good time to exchange your cards, a good time to actually start that collaboration that we really, truly want. So please get their names, get the, what part of the value chain they operate in, and how you can be beneficial to their business. So make sure you're connecting with at least one or two persons. So you have someone to your left, someone to your right. Ask them questions. You can start by complimenting them, maybe, and then ask them for what they do, their business. You never know. Your next business partner or your next investor may just be sitting next to you. So this is a great time to connect and ask the right questions. Awesome. I love the energy in the room. I totally love it. Great. Interesting. I love this energy. That's great. So make sure you take someone's cards or two people's cards, exchange your complimentary cards, take their numbers, ask for their office addresses, visit them, find out what they do, and you never know. You never know. You just remember today for good. Thank you. We have a tea break after the panel conversation, and of course, we'll get to engage in further networking. So let's come back into the room. Let's come back into the room. It almost feels like we were waiting for this moment. I'm enjoying this energy in the room. But thank you. We need to take the panel conversation now. And then we will go on a quick tea break where we can further network, exchange contacts, just start the collaboration from this room. Thank you. All right, thank you very much. And I think I have a very important announcement at this point, ladies and gentlemen. Okay. This energy is great, so I would allow the network and exchange of contacts. I'm loving it. I'm loving this energy. Fantastic. And if you are online joining us, please make sure you introduce yourself. Tell us what you do. You never know who's watching and who may pick up your contact and who's been looking for a business partner like you. So if you're a virtual participant or a virtual stakeholder, please use the chat room feature of whatever platform you're joining from. If you're using the events app, if you're using joining from Facebook or YouTube, just drop your name, drop what you do, drop what service you provide in this value chain, and let someone who is also joining virtually find you. So you're not left out of the networking happening in the room. So there's virtual networking happening on the app, on Facebook, and on YouTube, and there's also the networking happening right here in the room. There's exchange of contacts happening here. So to all our virtual participants, make sure you are networking and connecting on. Very good, very good. Very well done, everyone. So after the panel conversation, we will have a quick tea break before we return to the room. And of course, we'll have more time to network and exchange contacts amongst ourselves. All right, thank you, distinguished ladies and gentlemen. Welcome back from that quick networking break. Okay. I totally love this energy. I'm really loving it. We will take a panel conversation now. That is because I'm assuming that we are back from the networking break. But right after the panel conversation, we'll give room for about 2 questions and we'll proceed on a tea break before we return to the room. During the tea break, we can further network and collaborate and ask questions, network, take pictures, connect with people in the room. We have various stakeholders from across various parts of the value chain in the healthcare sector. So this is a great time to network, but that would happen during the tea break. We'll give a few more seconds so we can settle in before I introduce this stellar panel that will do justice to the conversation that focuses on the business of healthcare, talking about the challenges and, of course, opportunities, because it's one thing to iterate the challenges, but what is most important is to talk about the opportunities that are inherent in these challenges, especially as we've heard from our keynote speaker talking about victory coming from identifying the opportunities that lie within challenges. So we'll look at that in a few seconds once we settle in very quickly. But I would like to thank everyone for joining us. I was a little worried when the rain started. I thought the room would be half empty, but this is very impressive. We thank you all for making it here, whether you swam here, whether you drove here, however way you got here against all odds to get on this critical conversation. We don't take it for granted in any way. Thank you for supporting this cause that we passionately drive at Stanbic IBTC Bank. Okay, distinguished ladies and gentlemen, welcome back. Thank you. Thank you very much. Welcome back. Thank you for indulging me. And I feel like that was a very great part of today's breakfast session. We needed to collaborate, network, even from the room before we go on the bigger scale. And now a final announcement before I introduce our moderator. When all these partnerships have been formed, when you're about to launch your businesses, My name is Mojibade Shusoya, and I'm a professional compere. I host official launch of businesses as well, so please feel free to reach out to me after these partnerships have blossomed into something great. I would now like to invite on stage to do justice to the conversation that we are having next. Our conversation focuses on the business of healthcare, the challenges, and of course the opportunities. And I mentioned earlier that our keynote speaker spoke about how victory comes from identifying the opportunities that lie within challenges. So we'll be looking at the business of healthcare that we've been talking about, so the focal point of this conversation is on the business of healthcare. We'll talk about challenges and of course the opportunities. I'd like to make welcome our able moderator who will steer this conversation further. Please join me as I make welcome the head of specialized sectors at Stanbic IBTC Bank, Jane Ike Okoli. A round of applause for her. She'll come up stage to receive other members of this stellar panel who will do justice to the conversation. Now I'd like to make welcome the Chief Executive Officer of Iwosan Investment Limited, who is also the co-founder of Iwosan Investments Limited, a health investments holding company, and owners of Iwosan Lagoon Hospitals. She was previously director at Investment Fund for Health in Africa, a pioneer private equity fund focused on healthcare in Africa. She holds an MBA from Harvard Business School, class of 1999. I wasn't even born then, but that's okay. Please let's make welcome Mrs. Fola Lawi. Thank you very much for joining us. I'd like to also make welcome the Chief Executive Officer of Sygen Pharmaceuticals Limited. He's also the Managing Director at Sygen Pharmaceuticals Limited, bringing experience from previous roles at Coronation, Etisalat Nigeria, Diageo, and Diageo Nigeria PLC and Guinness Nigeria PLC. He holds a master's degree in management engineering at University of Pennsylvania with a robust skill set that includes strategy, business strategy, change management, strategic planning, business transformation, and more. Mr. Charles Ogunwuyi contributes valuable insights to this industry. Please give him a warm round of applause. I see that he didn't let me read his bio before he came up stage, but we're truly delighted to have you here. Next, I'd like to invite the founder and managing director, Tilit MSME Microservices Nigeria. Tilit MSME Microservices provides advisory and management services to public and private healthcare organizations across East and West Africa to maximize the value and outcomes of their social impact and commercial investments in healthcare and social services. He's a social entrepreneur, healthcare thought leader, and management specialist with a background in medicine. Please give a warm round of applause to Dr. Abayomi Sule. Thank you very much for joining us. Next, I'd like to invite on stage the COO of Codex Pharma Limited. She graduated from the University of Lagos in 2004 with a BSc honors in pharmacy. She worked at the Lagos State General Hospital as a pharmacist and later joined Innovative Medical Services Hospital, Lekki. She completed her MBA at the Lagos Business School in 2011, after which she began her business development career with Codex Pharma Limited. A round of applause for pharmacist Mrs. Mary Ogangu. Thank you for joining us. One more time, I would like to invite upstage our eminent, distinguished panel, our keynote speaker to join this panel conversation. A round of applause for Mrs. Claire Omasheye, who is the CEO of JNC International Limited. And finally, but certainly not the least, I'd like to invite the Chief Executive Officer of Bastion Health. She's previously worked at Access Bank as a senior manager and at AXA Mansard as a deputy general manager. Please make welcome with a warm round of applause, Ms. Naomi Aduku, to join this stellar conversation who will do justice to the business of healthcare. At this point, I will hand over to our able, capable moderator to steer the conversation from here. Over to you, ma'am.
Thank you very much. Thank you very much, Moji. Ladies and gentlemen, especially, ladies and gentlemen in the room, especially to our audience online. Once again, my name is Jane Ike Okoli and I head specialized sectors. I'm very pleased to be the moderator of this distinguished panelists. I am excited because we look at the team that we have actually carefully curated. They represent every player in the healthcare value chain. And speaking of the value chain, from the purchasers to the producers to the providers that you and I patronize every now and then, to the fiscal intermediaries, I want to call them intermediaries, and then last but not the least, the payers, you and I. Every part of the value chain is actually represented here. And I am even more excited that we would be getting thought-provoking insights and recommendations that would certainly add value, which is what Stanbic IBTC is known for, to our audience, as well as, audience in the room and our audience online. So without further ado, I'm just going to get right into it. I'd like to start with Mrs. Lowry. I think it's a known fact that medical tourism is a big challenge. We lose billions in medical tourism year on year. What are some of the reforms that the government has put in place that can sort of catalyze investment in the sector, specifically investment in centralized accreditation, digitization, and of course care guidelines that would further unify our fragmented healthcare quality standards? Yes.
Oh, great. Good morning. Good morning, ladies and gentlemen, and good morning, Jane. Of course, I don't think I have to sort of say too much about the fact that it gives me great pleasure to be here. Certainly, Stanbic has been sort of blazing the trail over the last couple of years with these discussions, and particularly also in putting their money where their mouth is, which is really great to see for the healthcare space. I think, yes, indeed, the context itself is important, the context of why, medical tourism in the first place. And I think, we know that has been happening really because there's been two issues. One is the infrastructure, that is on ground, to date, still has not really been able to catch up with the disease prevalence that Claire mentioned. The last sort of 10, 15 years, we've seen the growth of the very major diseases, the cancers and the heart disease, diabetes and so on, which, to be honest, we just are now playing catch up in terms of really having the infrastructure and expertise to be able to look after. And therefore, people have to seek, care elsewhere outside of our shores. But in addition to that has been trust, and that even as we have started to build that ecosystem locally, people are still finding it difficult to trust that what is on ground really can cope. I think COVID in itself created a little bit of, maybe I'll even call it, dare say, an opportunity, because with the shutdown and people couldn't travel, our community couldn't travel, we had to look inwards and find solutions and find care where we could. And it made, at least there was more of that interaction with what's on ground. Now, some of it was positive, and, but a lot of it was still, a lot of room for improvement. And that really has brought back, I think, the issue you've raised of, how do we really make sure that there are standards, there are guidelines, what needs to be in place to really help us to, overcome the trust